Corla, I'm mindful today in raising the matter of the health of frontline workers that in my own constituency the lives of 2 healthcare workers in St Luke's Hospital in Kilkenny were taken this week by this virus. I'd like to extend my deepest sympathies to the families, to the colleagues and to the friends of these people who tragically died. May they rest in peace. Their passing brings into sharp focus the daily risk of our healthcare and frontline workers here and across the world. Many have lost their lives trying to save the lives of others. Their selfless actions need to be met with all of us through collectively acting to stop the spread of the virus in our community. While gestures of solidarity, shining a light, putting out flags and rounds of applause are important and appreciated by our frontliners, the most effective thing we can do is to stick rigidly to the plan, stay at home and maintain social distancing. At a later date, when we leave the eye of the storm, we might consider how a national day of reflection of the sacrifices of our frontline workers, but for now we mourn their loss and we thank them for their work. Concur, in light of the events of this week, I wish to focus on the Employee Assistance and Counselling Services, a free service, HSE-funded service of the community, hospital and health settings. I want to pay tribute to the team within the EAS programme, a small but dedicated team who offer a broad range of counselling and psychological support services to HSE staff at all levels, from psychological first aid, an important check-in service to frontline workers, to more structured video and telephone counselling in accordance with social distancing. It is clear that the well-being of staff is placed in high regard, not just during this crisis, but at all times. It is important that the Minister would address gaps that exist in this excellent service. If there are geographic areas not covered by the EAP, I think it is vitally important that these resourcing issues are addressed. It is important that the hybrid model of staff wellbeing under the EAP, drawing on resources of external counsellors who provide 24/7 service, is available and critically communicated to staff in every hospital and facility in the state. Critical incident stress management is another important area and core to the interdisciplinary approach of staff wellbeing. A constant process of checking in with staff would seem to me to be very important. It's about embedding resilience in the system to minimise burnout and undue stress. Today, Ceann Comhairle, is important to highlight the availability of such vital services, to thank all of those involved in supporting their co-workers, but also to ask that the gaps be filled and that the sufficient resources are available regardless of geographic area. The use of local community and voluntary services could be of assistance to those in the wider community. This could be done under the coordination of local community response teams in liaison with the community call teams in each local authority area. Local community and voluntary mental health and bereavement support services could offer additional services to families bereaved either through the coronavirus or through other causes unable to celebrate the life of a loved one due to the current restrictions. In advocating a role for the community-based support service, I must once again stress the importance of keeping the doors of our voluntary services open, given that these fundraising opportunities for such services have all but dried up since the crisis hit. These services are vital now if we are to emerge from the health and social care phase of this pandemic. I want to raise as well the issue of masks, Ceann Comhairle. There are hundreds now, all over the country, ICA groups and other community organisations who are making cotton homemade masks for free distribution. The WHO, European Centre for Disease Control, have endorsed the role of masks in reducing infection. Countries such as Taiwan and Vietnam have vastly lower numbers of infection than neighbouring countries, due in some part to wearing of masks. I am of the view that the wearing of masks could help gradually ease the restrictions, and I would ask for clear guidance from the government on this. And finally, I just want to continue to wish the Taoiseach, Tony Holohan, our CMO, and our government well in the continued work that they're doing, and appreciate the cross-party support. Thank you.
Deputy's comments about the need to protect the health and mental health of our HSE staff, and I think the points that he made were very, very relevant and very well made, and something that I bear in mind every day, knowing so many people who work in our health service at the moment and the pressures that they're under. Just in relation to masks, I think a lot of us will have been following the debate around the wearing of face masks. There is no dispute that people who have symptoms, are sneezing or coughing, should wear a mask in order to reduce the chances of them passing the infection on to others. There's no debate about the fact that people in healthcare settings caring for patients with COVID should wear a mask, and a respiratory mask in particular circumstances. There are differing opinions, and the experts don't agree on whether masks or face coverings should be worn more generally. Some say it's effective, some say it's not effective, some even say it can be counterproductive, particularly if people are not changing the mask regularly, or not washing it, or hanging it around their neck, or touching the mask. So the jury is totally out on whether it's a good idea or not for the asymptomatic population to wear masks in public. But certainly the trend seems to be going that way, in favour of that. Whether that's backed up by science or not is more questionable. But what we'll be doing as a government is taking the advice of the National Public Health Emergency Team on exactly that question, which they're considering again this week as to what advice we should give people on the wearing of masks. But one thing we definitely need to make sure we don't do is create a supply problem with masks. At the moment, we have a lot of masks for our healthcare staff, for those who need them. But if we were to have everyone in Ireland wearing 4 million masks a day, we wouldn't like to end up in a situation whereby there is then a shortage of masks for our healthcare workers. So we have to bear in mind all of these different issues and constraints and prioritisations. Just going back to Deputy Doherty, asked you about a particular delivery. I honestly don't know. I'll have to check up on that. There are different deliveries coming all the time. 30 due from China alone. Not sure if the one came in last night or not. Others from Ireland, others from EU countries. But an issue has arisen with deliveries from China as a result of new customs controls that have been imposed by the Chinese provinces to check the quality of product before it goes out, and that will cause a delay in those deliveries, or some of those deliveries, which we wouldn't have been aware about until the last couple of days.